Before modern medical imaging, doctors had a very limited understanding of the human body. Early doctors often avoided studying anatomy deeply because they feared death and the religious or cultural rules around it. Even when they did try to study the body, medical knowledge couldn't advance much because of problems like bleeding, infection, and pain. There wasn't good anesthesia or ways to prevent infection back then. Most medical procedures were basic, like stitching wounds, amputating limbs, or removing teeth and tumors. And since they couldn't look inside the body, their theories about how organs worked were mostly just observations from the outside. Things started to change when Leonardo da Vinci created detailed anatomical paintings. These increased interest in human anatomy and inspired more study. Eventually, medical schools began dissecting the bodies of criminals, either people who donated or were given over after death. 1895 is when modern medical imaging truly began. Wilhelm Röntgen was experimenting with electrical currents when he discovered X-rays. He noticed that the rays could pass through skin but not bones. To prove it, he took the first X-ray picture of his wife's hands, and you could clearly see the bones even on her wedding ring. By the year 19,000, X-rays were being used by doctors all over the world to detect injuries and illnesses inside the body without surgery. Röntgen received the very first Nobel Prize in Physics in 1901 for his groundbreaking discovery. X-rays are basically strong energy waves. When they pass through the body, bones block more rays, so they appear light on the image, while softer tissues appear gray. At first, people didn't know that too much about X-ray exposure can damage cells and raise the risk of cancer. It took time before safety measures like lead aprons and limited exposure were introduced.
So, modern medical imaging talks about x-rays only show flat 2D pictures of the body. They can only be taken from one angle at a time. Newer medical imaging uses advanced computer technology, and these newer scans create detailed 3D image. So, computer tomography. Tomography means imaging the body in thin sections. CT is a scan using computers and x-rays. The scanner rotates 360-degree angle around the patient to create detailed slices. It was invented in 1970s and improved with modern computer software. This is especially useful for short tissues like the brain, chest, and it provides very precise details measuring down to a millimeter. Magnetic resonance imaging is a scan that uses magnets and radio waves instead of radiation. It was invented in 1970s and widely used by the 1980s. Provides highly detailed images, especially helpful for finding tumors. Some drawbacks are expensive, loud, long scan times, and uncomfortable for some patients.
Hi, my name is Arlene, and I'll be explaining positron emission tomography, or otherwise also known as PET scans. So what are they? They're medical imaging tests that show how organs and tissues function and not just how they look. How they work is a small amount of a radioactive tracer, often similar to glucose, is injected into the bloodstream. So then cells absorb it and the scanner detects that activity to create images. PET scans are especially useful for detecting early cancer, infections, thyroid disease, brain conditions, and heart disease. They also monitor how well treatments work, and they can even be combined with CTs or MRIs for more detailed images. However, the main cons of PET scans are they are expensive, they do involve radiation exposure, and the fact that blood sugar can affect results. So moving on to ultrasonography, or also known as ultrasounds, these are medical imaging tests that show detailed pictures of structures inside the body. They are commonly used during pregnancy, but they can also be used to capture images of the abdomen, tissues, blood vessels, the heart, and other organs. The method works by sending high-frequency sound waves through a device called a transducer. These sound waves echo back when they hit tissues, fluids, or organs, and they're used to create live images. Some big advantages of the ultrasound is that it is safe, they use no radiation, it's primarily really inexpensive, and it provides real-time imaging. On the downside, however, the imaging quality can be sometimes inconsistent and it isn't useful for every part of the body. Overall, it is pretty safe to use and very affordable.